are live. This is a an interesting thing for me because the man that you see on the screen is my college roommate, Dr. Bart Radolinski, which we've never had occasion to do like an actual work thing together because he's a urologist and I'm a political journalist. And those two fields don't often come into contact, but this is an instance where they do because with the announcement Sunday afternoon that Joe Biden has prostate cancer, I reached out to Bart and I said, can you basically just fill us in on all of this stuff? Like, what is it? What have you seen of this? What do we know about it? So we're going to start pretty basic. If you all have questions for Bart, I'm happy to post them and I'm happy to try to grab them. He is a urologist. He went to, thankfully for us, Georgetown undergrad and Georgetown med school, so he's a good one, right, Bart?
And Georgetown residency.
And Georgetown residency, yes. So, okay, Bart, let's start like super basic. So we got a statement from Biden's office, and I'm just going to summarize it. Basically, they said he has a small nodule on his prostate. Biden's cancer is characterized by a Gleason score of 9 with metastasis to the bone. All right. Let's break down each one. Small nodule. What do we, I mean, I don't want to draw too much from it, but is that very typical? Like, what do we draw from that? And then I want to ask about the other stuff.
Yeah, so the most common way that we diagnose prostate cancer these days is actually by a blood test called the PSA, which stands for prostate specific antigen. And that's usually followed up with a prostate exam to look for nodules. So both of these avenues are pretty common in the diagnosis of prostate cancer. The diagnosis is technically made via biopsy. So if the blood test is suspicious or the exam is suspicious with a nodule, as they reported for Joe Biden, the next step is a prostate biopsy, which is a 15-minute procedure usually done under a local anesthetic to actually get tissue from the prostate so the pathologist can look at it under the microscope and determine, do they see cancer.
I want to go back to one other thing, which is it says that that Biden sought medical help after urinary issues. What does that mean, generally speaking? I mean, I know. Look, I should say this at the top. Bart is not seeing Joe Biden as a patient, so he is talking in general terms, not about Joe Biden specifically, other than the details we have about Biden that have come through his office.
That's right, and they've actually shared quite a bit, especially if you contrast it to. I just was reminded of King Charles in England, where it's an undisclosed cancer they found during a prostate
Right.
procedure. But they actually gave us quite a bit of information about President Biden. Um, so well, you're going to have to repeat your
The
question because
urinary. They
oh,
said
right,
this is the reason. The reason that he sought sort of
that's right,
was the ongoing urinary symptoms. I didn't know what that meant.
that's right. So the age for screening for prostate cancer, which means getting the PSA blood test, potentially checking a prostate exam, the American Urologic Association suggests that should be done between the ages of 55 and 70. The National Comprehensive Cancer Network, which publishes guidelines multiple times a year on many different cancers, their age range is 45 to 75, I believe. So Joe Biden technically was older than the age at which you would screen someone with these tools for prostate cancer.
Hmm.
And not to sort of get into the weeds about why we stopped screening and so forth, but the short version is we don't want to overdiagnose patients where it may not make a difference to their overall health.
Right.
But Joe Biden's case is interesting because when you develop urinary symptoms, one of the main causes in men is an enlarged prostate. And this is usually benign, just a benign overgrowth of
Mm-hmm.
prostate tissue causing a blockage in your urinary channel, and that disrupts the way that your bladder functions. So, one of the things a physician will do in the office is examine the prostate. And during that exam, my presumption is they felt a nodule and they said, well, your symptoms are your symptoms, but hang on a second, we feel this lump here that deserves attention because of the possibility that it could be prostate cancer.
And just to remind people who are joining, I know a ton of people have come on. This is a unique opportunity for me. The man on the screen here is Dr. Bart Radolinski, who, in addition to being a urologist, is also one of my longtime and closest friends and my college roommate. So when this happened, I said, can you get on with us and just try to educate us about this? Because, I think unfortunately the reality of politics these days is there's so much misinformation going on both sides. Let's talk to an actual doctor about this. All right, so Bart, the thing that I didn't understand the most out of all of this is, and I'm quoting here from the Biden thing, they said his cancer is characterized by a Gleason score of 9. I have no. Can you explain to us what that means?
Sure. So the way that we typically describe cancer of any type, not just prostate, is by its grade and its stage. And grade speaks to the aggressiveness of the cancer, and stage speaks to the extent of the cancer, how spread throughout the body is. So when they're reporting the Gleason score, they're describing the grade of the cancer. How
Okay,
aggressive is it? The Gleason scoring system has been around for decades, and it's actually been, I don't want to say replaced, but there is a additional scoring system with which you see in some of the reporting where they describe a grade group. Gleason score of 9, short answer is that it indicates an aggressive prostate cancer, or grade group 5, which is on a scale of 1 to 5 of aggressiveness. So the reason they went to this grade group system is that people, I think, intuitively understand if I'm on a scale of 1 to 5 of aggressiveness, 1 being least aggressive, 5 being most aggressive, I'm at a 5, then I know that I'm on the aggressive side. The Gleason scoring system is a little more complicated, but again, the short version is this is aggressive prostate cancer.
and I'm going to ask a dumb question here, but how are they able to tell the grade of the aggressiveness of the cancer based on a biopsy? I mean, and
So
I'm assuming that that's what it was based on. I don't know if
that
it
is
is.
that is right. Yeah. So the tissue that's obtained during the prostate biopsy is then given to the pathologists, and the pathologists fix it to a slide, and they look at the cells under a microscope. And based on patterns that they've seen thousands of times in terms of how the cells look like they're dividing under the microscope, of course they're not actively dividing because they're fixed to a slide and frozen in time, but they can basically identify the pattern. And in fact, it's often called Gleason pattern 9 or Gleason pattern whatever,
Got it. So it's
because
just it's they're basically looking at a bell curve. Like if it's in this kind of space, it's this level of aggressiveness.
yeah, and the pathologists, they do so much of this that it's almost second nature to them. They can look at it and say, oh, that's a Gleason, whatever. And just like a dermatologist would look at a rash on your skin and say, "Oh, that's eczema,"
Yeah.
because
Okay.
they just recognize the pattern. And there are certain criteria that they can reference if there's a doubt. But it's basically the tissue under the microscope that the pathologist looks at and then gives a report to usually the urologist, which is the physician that's doing the biopsy, so they can then take care of the patient.
All right, and then let's talk about and again, like I think we have all either dealt with someone with cancer in our close lives or in our outer circle, and to me, layman, I read, and this is again, we're just going through the Biden statement to start, folks, just in case you're just joining. Metastasis to the bone. Chris Cillizza, political journalist, knows that metastasis anywhere, generally speaking, for cancer is bad, but bad is not a technical term. So can you like what is that tell you as a urologist? What is that?
Yeah, so the grade of the prostate cancer, that Gleason score, that grade group that we were talking about, which identifies the cancer as being aggressive, well, it's behaved aggressively and spread
Yeah,
outside of the prostate and into the bone, which is a very common place for prostate cancer to spread. In fact, I think
okay,
it's the most common site of distant or metastatic disease. And metastases, that's just what it means, that it's moved beyond the primary organ to some other part of the body. So they're telling us that Joe Biden has disease that's not only aggressive in his prostate, but it's also acted aggressively and moved outside of the prostate and spread to the bone. In some of the reporting that I've seen, I think they're still waiting on more scans, a PET scan, to see what is the true extent of the bone spread. Has it spread to other organs throughout the body, and basically to get more of a roadmap of what the prostate cancer is doing. But in terms of the question you're asking, I think is prognosis, what's the likely outcome here, given that the prostate cancer is spread to the bones? I will say it's not great, but it is much better than it would have been 5 or 10 years ago because we have so many more advancements now in the last decade, specifically for what is called advanced prostate cancer. So when prostate cancer is moved beyond the prostate, we call it advanced because it's advanced beyond the
yeah.
primary organ. And especially prostate cancer that's spread to the bones, there's at least half a dozen treatments that have come out within the last, I'd say, 10 years, which greatly improves the outlook for President Biden because we have just so many more tools in the toolkit to manage this type of prostate cancer specifically.
And is this, again, layman approach from me? Is this what is the likely course of treatment with the caveat to your point that they are still doing more testing? But what is are we talking about? Are we talking about radiation? Are we talking about surgery? Are we talking about chemotherapy? Like, how do you? And I would say, given let's talk more broadly. If I came to you and said, "There's an 82-year-old man, Gleason score of 9, metastasis of the bone," because we don't know all the details on Joe Biden. So just give me your broad, like, 80-ish-year-old man with this presentation. What would the course of treatment
Yeah,
be?
so what they've reported for President Biden is enough information to at least answer part of that, meaning surgery and radiation to the prostate are really no longer options because the
Okay,
prostate cancer has spread beyond the prostate, so it doesn't make a lot of sense to try to certainly surgically remove the prostate or even radiate it because, well, the horse is out of the barn, so to speak.
okay.
So that puts us into the territory of systemic treatments, meaning treating the cancer everywhere in the body. Um, Interestingly, for prostate cancer, while there is or there are chemotherapeutic options, generally we rely on hormone manipulation and immunotherapy more commonly these days.
Huh.
Um, and when I say hormone manipulation, this has probably been around for, I would guess, 75 years. And the hormone that we're manipulating is testosterone.
Okay.
So the first thing that his doctors are going to do, and I would bet they've already done it, is to put him on a medication that will lower his testosterone basically as close to zero as possible. And what
Because
that
testosterone would fuel the growth of the cancer?
Yeah, and this is a tricky sort of subject because when you say that, sometimes the message comes across that testosterone causes prostate cancer, and that's not really how it works. But we do know that lowering testosterone to what we call castrate levels, meaning as close to zero as possible, robs the prostate cancer cells of the fuel that they need. Um, so it's sort of this is going to be a terrible analogy, but it's the best I can come up with. It was the idea that water will put out a fire, but dryness does not cause fires,
Right.
right? In and of
I
itself,
understand that.
your
Yep.
your
I
your
think
living
that's a good
room
analogy.
yeah, your living room or kitchen table is not currently wet, but just because it's dry doesn't mean it's on fire. So,
Yes.
anyway, I don't want to get the impression or give the impression to people that testosterone is causing prostate cancer because lots of patients are on testosterone replacement therapy. These are people that are, being treated for things. So, I want to cause a panic about testosterone and prostate cancer. But we have known for many decades that lowering testosterone levels very often will halt the progression of prostate cancer throughout the body.
So no surgery, no radiation, because it's too advanced. And then I want to make clear: is it possible he undergoes chemotherapy of some sort or not?
So the short answer is yes. There are chemotherapies in the traditional sense where they disrupt fast-growing cells, and you get a weekly or monthly treatment of an IV infusion, intravenous infusion of the medication. More commonly, we use immunotherapy medications, which are potentially infusions that specifically target the cancer in the bones, or oral medications, pills that you would take that would more effectively block testosterone receptors to keep the testosterone from getting to the prostate cancer cells. So these have really moved to the forefront. But when people think of chemotherapy, sort of the general idea is it's a systemic therapy, even though technically it may not be what an oncologist, a cancer specialist, would describe as chemotherapy.
Yeah.
But yes, we're in that
Okay.
space of systemic therapies, whether it's a pill, an injection, or an infusion of some type. But localized treatment like surgery and radiation is not really in the cards at this point.
And that is because it's spread.
Right.
Okay.
Which also means there really isn't a plan for cure at this point for President Biden.
So what is
So,
that? Explain that to people.
so once the prostate cancer has spread outside of the body, the goal is
Outside of the prostate.
excuse me, outside of the
Yes.
prostate. Yeah, if it's outside the body, that's really
Yeah,
gone
that's a
poorly.
whole other issue. Yeah.
But yeah, outside of the prostate, which means your goal is to arrest the spread and basically halt the prostate cancer so that it simply doesn't have any further health effects on the patient. Um, so it is entirely plausible that once they know more about President Biden's prostate cancer and the extent, and then his response to initial treatment, they may come out and say, this is likely to last for years, even to the point where, not to be morbid, but something else gets him
Yep.
besides the prostate cancer.
Yep.
So that's how far advanced our advanced prostate cancer treatments have come in the last decade or so. We just have far more tools in the toolkit to manage the disease, even when it's outside the prostate.
So I want to ask you. We're going to get into more sort of controversial space here, because a lot of people are asking it in the chat here, and Zeke Emanuel, oncologist, his brother is Rahm Emanuel, the former White House chief of staff, mayor of Chicago. Zeke Emanuel, very prominent doctor, was on Morning Joe this morning, and he said President Biden has had prostate cancer for years. This is his supposition. He's not saying, but President Biden has had prostate cancer for years. He told MSNBC the White House medical team either didn't test, didn't do the test other White House teams have done, or hid the results from the public. Can you talk? I don't need you to respond directly to that, but can you talk about a lot of people I have seen, doctors, not just people popping off on the internet, in the last 24-ish hours have said this, he had as all presidents do, he had an annual physical in February of 2024. Is it possible that nothing, that they did what you said, the PSA test, the blood test, and found nothing? Did they not do it? Should they have done it? Like, what's your, and again, I always want to take this out of the context of Joe Biden in particular, because you have not examined him and we do not know all the details of his case. I would say an 82-year-old man, or I think he was 81 then, an 81-year-old man. Is this something, because it comes in the context, obviously, of, what was Joe Biden's mental and physical acuity and abilities, in the last 2 years of the White House. So when you heard this, did you think it's odd we didn't know this when he was still president of the United States?
The short answer is yes.
Okay.
That was my first thought, and as I mentioned earlier in our discussion, in the average 81, 82-year-old, there is a reasonable, a plausible pathway where exactly this happens because the screening age, depending on which body of recommendations you follow, either ends at 70 or ends at 75.
Right.
And it's possible that a patient at 81 really didn't have, so they decide at that age, okay, they speak with their doctor, they decide we're not going to screen for prostate cancer any
Because basically,
further.
even if you get it, it's very likely you die from something else. Is that fair? Is that why they
That's
don't test it?
Right, that's the idea, that it
Okay.
will know that further testing after a certain age will not help you live a longer, healthier life,
Got it.
in the diagnosis. So that's probably the best way to phrase it. So it's plausible that he reached the age of 70 or 75, and he had a conversation with his physician, and they decided we're not going to screen for prostate cancer anymore because what we just talked about. Um, and that means no further PSA blood tests, and then not getting a prostate exam until urinary symptoms developed, which they describe in the reporting happened relatively recently, which then prompted a prostate exam and then finding the nodule and then going down this pathway
Mhm.
of biopsy and the diagnosis. So that's what I would describe as that's what would happen or potentially could happen with the average patient. However, the president of the United States
Right.
is not the average patient. So it is a little bit harder to believe that at age 70 or age 75 that they simply stopped checking his blood tests, stopped doing a prostate exam because of the guideline recommendations. On a more human level, on sort of a personal level, as his physician, you don't want to be the one who misses prostate cancer. And it
Right.
doesn't matter what the age is, he's
Right.
the acting president. So then we get into sort of like, well, okay, that's how you could imagine this happening to the average patient. president of the United States is not the average patient. So you would imagine, and you see this with celebrities, people that have means, the tendency is over diagnosing things,
Exactly.
over screening, like, getting full body CT scans every year, looking for any abnormality and so forth. Things that no doctor would recommend to their average patient, but because they are celebrities, they have means, or they just feel like, well, I know what the recommendations are for the average person, but for me, I just want to get tested as often as possible for as long as possible to detect anything as early as I possibly can. So it is a little bit surprising that the president of the United States didn't have a prostate exam in February. And to answer your question, is it possible that a nodule was not on that exam in February? It's possible, but it's
It's
been,
very unlikely. Is that
yeah,
fair?
I would say it's very unlikely.
Okay.
And it's likely that before he even developed a nodule, his PSA, the blood test for screening for prostate cancer, would have been elevated.
Yeah.
So we do have situations where it doesn't work that way, and we see that the PSA never indicates prostate cancer, but we do find a nodule, and that's why we sort of do both the blood test and the physical exam portion of it. But again, you're getting into rarer and rarer air in terms
Yeah.
of what
Right.
is the likely course that happened.
Um,
Um,
okay, so I want to, and I want to be mindful of your time, so I want to do just a couple more minutes. What are the obviously this happened at well, we heard about it at 3:30 roughly on Sunday afternoon. We're far less than 24 hours into it. What are the signposts, or what should people be looking for as we learn more about this that would suggest, okay, this is more manageable or this is more problematic? Are there things I should say?
So they're not going to know things probably for a few weeks, even a few months in terms of response to treatment, um, because they're going to do things like suppress the testosterone, start the additional immunotherapy medications, the androgen receptor blockers, most likely, try to treat the metastases in the bones, which is also an infusion type medication, and then get scans in the future. So likely, if they haven't already gotten a PET scan, that'll be the next step in terms of what's the extent and breadth of the prostate cancer throughout the body. And they may say that, well, this is more than we thought, that it's in the solid organs, it's spread to more than just the bones, which changes and probably worsens the prognosis a bit. Um, but the next step will be response to treatment, which we'll see months down the line after treatment started, and then repeat scans are obtained to say, okay, are the tumors in the bone shrinking? Are the blood tests responding
Hmm.
appropriately, and so
Hmm.
forth? So those will be the next steps.
And last thing, and you mentioned this a little, but I want to leave people with this broadly, and I'm not going to ask you for specifics, but a broad prognosis of this is what?
I think there's a prognosis that we use that's called guarded, which is entirely straddling the fence.
Yeah, right. Yes.
Basically, it could be good, but it could be bad. So
Right.
but I think he's in that regard. But as I said, it would be perfectly within the realm of expectations that his doctors come out and say he's doing well with treatment. We expect that he's going to live for the number of years with this prostate cancer sort of halted and arrested. And as I sort of mentioned earlier, something else gets him
Yep.
before this prostate cancer does. So that I would not be surprised if that was the conclusion or the reporting that we get down the line.
Okay. Folks, if you joined us live, I hope, I mean, I reached, again, this is Dr. Bart Radolinski, a urologist. We went to Georgetown undergrad together. He went to Georgetown Med School. He did his residency at Georgetown. I reached out to him because I feel like there's so much misinformation already out there. If you missed any part of this conversation, I will put it in my Substack and send it out to folks so you can watch the whole thing from the beginning. But Bart, I just want to summarize, which is sort of guarded prognosis, um, unlikely though not impossible that it was probably in February 2024 when he had his last physical as president, that it was present either in the PSA or in an actual prostate exam, um, and sort of uh, aggressive form of cancer, but we don't know the extent to which we know it is metastasized to the bones. We don't know the extent to where. Is that all fair as we summarize it?
I think that's accurate. One other thing that I thought of in the entire discussion and the disclosure of this diagnosis for the president is his cognitive issues. Sadly, one of the side effects of the main treatments, the testosterone suppressing treatment specifically, is worsening cognitive function. It's something that a lot of
Really?
patients,
Huh.
yeah, something that a lot of patients, especially the older patients diagnosed with prostate cancer, that have to be on this medication, is that they feel foggier, they feel less sharp.
Okay.
So it
And
it
that's
was just
because
sort
of
of,
the testosterone reducement?
yeah,
Okay. All
yeah.
right. That's
At
great.
least
Thanks.
that's what we think. Yeah.
Okay. Bart, thank you for your time, folks. Again, this is a special thing for me that I have this relationship with Bart. We were able to bring him on, less than 24 hours after to give us a broad overview of where we're headed. Thank you for taking the time, Doctor.
No problem, Chris. Happy to help.
All right. Appreciate it. All right, everyone. Take care. Be well.